Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and healthcare professionals talking about health topics of importance to local residents. Today we are visiting Oceanside Family Medicine in Southport. Oceanside Family Medicine has recently added urology and surgical services to their practice here in Southport. We will have the opportunity to speak with Dr. Pilar Johnson of Oceanside, Dr. Richard Scallion of Novant Health Surgical Associates, and Dr. Stephen Robbins of Novant Health Urology Partners. We have a great show planned for you today, so come on, let's go inside. Well, Dr. Scallion, thank you so much for taking time out of your day to join us today.
No problem.
Now, I know many of our viewers have had the opportunity to meet you before, but just for those who haven't, tell us a little bit about yourself.
Well, I'm a general surgeon. I actually trained in Wilmington and prefer a broad range of general surgery procedures, anything laparoscopic, hernia repairs, cancer surgery, and a variety of other things.
Mm-hmm. Well, tell me about your practice. I believe it's called Novant Health Surgical Associates. How many providers are in your practice?
So there's a total of 4 of us. There's 2 surgeons and myself, so a total of 3. And we also have a nurse practitioner. And we're in the process of hopefully hiring a 4th surgeon fairly soon.
Wow, that's awesome. You guys must be busy.
We are busy, and it seems to be getting busier all the time, so we should have plenty of work for a new surgeon.
Mm-hmm. Well, I understand that you've recently added the Southport location as well. And are you the surgeon that will primarily be here in Southport?
As of now, I'm the only one that will be down here.
Mm-hmm.
When the new surgeon starts, we'll see if there's enough work also for a second provider. But for right now, it's just myself.
Mm-hmm. What types of services will you provide here at the Southport location?
We'll pretty much provide anything that we would have provided at our main office.
Mm-hmm.
So we can do...
so here in the office you'll do consultations and first-time appointments and
correct.
What have you. Yeah.
Appointments, and we can do minor office surgeries.
Oh, okay.
So.
Well, I know that you do offer a large range of surgeries. Tell me about some of those specialties.
Well, I offer any type of laparoscopic surgery, a variety of laparoscopic, such as hernia repairs,
okay.
gallbladder,
Mm-hmm.
you can do colon resections,
mm-hmm.
and things such as splenectomies and adrenalectomies,
mm-hmm.
and Nissen fundoplications, which are for heartburn.
Oh, that sounds like something I might need. I have heartburn a lot. Well, I believe that you offer a large range of surgical options for cancer treatment. Is that correct?
Yes, thyroid cancer,
mm-hmm.
colon cancer, breast cancer. We do biopsies in the office. We also do stereotactic biopsies in the hospital. So we offer
mm-hmm.
a wide variety of, hopefully, just about anything anybody would need.
Mm-hmm. Now, I know that you have privileges at Brunswick Medical Center, but I believe you have privileges here in Southport. Is that correct?
Correct. I do the majority of my surgery at Brunswick, but I also have privileges at Dozier. So if somebody would prefer to have their surgery at Dozier, that would be fine.
Now, I know that you have a very nice relationship with Dr. Zukowski here in Southport, as well as with the Dozier facility, because you've done quite a few procedures here already.
Correct. It's a nice facility. They have a nice operating room. Dr. Zukowski is the surgeon that's been down there primarily for several mm-hmm. years, and he's very nice to work with. Mm-hmm. So certainly great. I would have no problems doing procedures down here. Great.
Well, I'm curious, do most patients need a referral to see you?
I guess the best answer for that is
Maybe.
It depends on their insurance.
Yeah.
I believe if it's Medicare, you don't, but Medicaid or a variety of other insurances, you may need a referral from your primary care provider.
Well, that's something maybe the office staff could look into for the patients who want to see you here?
Correct. They could simply call the office and they could help direct the patient as to whether or not they needed an official referral or not.
Well, I know you're only here part-time, so how often are you here in Southport?
I have office hours every other Tuesday morning, and for now that's the plan. If it gets busier, then I would come more often.
You would extend those hours if necessary then?
Either a full day on Tuesday or more than likely it would come every Tuesday.
And then, of course, when you add the new physician, who knows how busy, and you might even have more hours.
That's right. Maybe he would come down here every other Tuesday, so
Right.
somebody would be here every
Well,
week.
that's good. We'll stay tuned for that information.
Okay.
Well, for viewers out there who might have a question about scheduling an appointment or just have questions about their insurance, which office should they call? Should they call here in Southport or call the Bolivia office?
It would be easiest to call the Bolivia office, and they can answer any questions. And that's our main number, and it's 910-721-4000.
Great. Well, thank you so much for that information. It's been great having you here, and welcome to Southport.
Thanks for having me.
Dr. Johnson, thank you so much for taking time out of your day today. I know how busy you are, so we really appreciate this.
My pleasure, June. Thanks
Great.
for having me.
Great. Well, before we get started, let's talk about this office and exactly like where it's located in Southport.
Sure. So we're located on Howe Street, on North Howe, and we are very close to the intersection where River Road comes into Howe Street. It's almost directly across from the Walgreens.
And that's a great place to be, directly across from Walgreens.
It is. It's convenient.
That's great. Now, I know that some of our viewers have met you on one of our previous shows, but for those who may not have seen that show, tell me a little bit about yourself and where you went to school.
Okay. So I am originally from North Carolina. I went to undergrad at UNC Wilmington, just up the road, which is where I live now. I did my medical school at a school called American University of Caribbean in St. Martin. I did my residency in the great state of Maine, and I've been back here since last summer.
Great, great. So you joined the practice in 2014, is that correct?
August 1st, 2014 was my first day.
Great. And do you see patients of all ages?
We do. We see infants right through the elderly, and that's what family practice is all about, so that's why we're here.
Like birth to death, right?
Absolutely.
Well, I know you have a partner here, and I believe it's Dr. John Moore.
It
Is
is.
that correct?
That's correct.
So why don't we kick things off with a tour? And I believe where we are now, this is your main waiting area. Is that correct?
This is the main entrance into our office, and
You're on the second floor here in this very nice building.
We are.
But there is an elevator, so that's great.
absolutely
great
is.
for patients.
And then check-in is right where
Right
we
here?
are here.
Okay, great. Well, let's get started.
Okay, sure.
Okay.
In this way.
Thank you. So this is what? This is sort of behind the scenes where everything goes on in terms of business. And is this checkout or check-in?
It's a little bit of both. So
Okay.
check-out is where Heather's sitting right here, and right behind her is check-in. So you exit the same way you enter in this facility. And then you'll also see Heather in the back sometimes helping us out as well. So
Good job, Heather. Okay, let's continue around the corner then.
okay.
So this looks like a lot of charting areas. Is this someplace where nurses would typically sit?
Yes, it is. So this is the main nurses station. We'll also generally have one that sits here. And these are 3 treatment rooms. This is Dr. Moore's side of the office, actually. We have another identical side over there, but all the treatment rooms are basically set up the same. And then Dr. Moore's office is in this corner.
Okay. While we're here, let's talk a little bit about MyChart. I believe that you are on MyChart.
I am.
And what is that website where you access MyChart?
I believe that one is NovantHealth.org.
Okay.
And the cool thing about MyChart, you can go in and check your own labs. You can email providers.
You can email providers?
You can.
So if I'm on MyChart and I email you, because actually you are my physician, so I may be emailing you.
may.
and I ask you a question. What can I expect? Because I haven't done that yet.
Right. So the email will make its way to me, and then I'm able to respond back to that email and start that. We can start that dialogue together. And
Is there a time frame where you could expect a reply? Is it generally within a couple of days?
it's generally we try to do it within the same business day. That doesn't always happen, but that's the
Sure.
goal usually.
Sure. Well, that's great. How about prescriptions? Can I refill a prescription? Can I ask for a refill?
You can. You can also ask for prescription refills online as well.
And I believe I can make an appointment.
You can. You can. You actually can. You can make same-day appointments if you want, or schedule out farther.
So I can
as
schedule
long as there's space available. Yes,
Right,
you can.
and you could be able to tell once you're on there, you can see what's available and what's
Yes, you
not,
can.
and I can just click on and schedule that myself. That's pretty cool.
Absolutely.
Now, I understand that you've recently extended hours. Is that correct?
We will be extending them starting June 1st. Yeah.
Okay.
From 7 a.m. to 6 p.m. Monday through Friday.
That's awesome because, you know, sometimes we all work.
We do.
And, like, we can't take time off work to see you, so that makes it really convenient for patients.
And that's what we're hoping.
Great.
Yeah.
All right, well, let's take a look at one of the treatment rooms.
Okay, sure.
Okay? So this is one of the treatment rooms, and how many do you have?
7.
7, and they're all pretty much the same?
They are. They're set up pretty similarly.
Okay, great. It's very nice. Very nice. I love the floor.
Thank you.
It's
Colorful.
It is very colorful. Great. All right, well, let's move on.
Okay.
Thanks.
So now let's take a look at the lab.
Okay, great. I'm excited to see the lab. Okay, we're here at the lab. Now, tell me what happens now.
Okay, so this is Karen, our fabulous lab tech. that
Hey, Karen.
All of our patients
Hi, how are
love.
you?
Good.
So basically, when we order labs, we draw them here. Karen draws them for us every day, and then we send our labs up to LabCorp for processing. So we generally will have the results back the following day, and are able to contact patients and let them know their lab results. It's a big bonus for the patients because they're not having to go anywhere else to have labs drawn.
Right.
And because Karen's very good at her job, so they all love her. So it's worked out really well, and patients seem to be really pleased with it.
Great. Yeah, I love the idea of having it right in-house so that you don't have to go anywhere else.
Right.
That makes it much easier on the patient.
It does.
So, great. All right, let's continue.
All right.
So we're here in the other side of the building, which is a mirror image of the side we just visited. And these are predominantly your rooms. Is that correct? Your
Correct.
treatment rooms?
Correct.
And your office is located in this end.
It is, absolutely.
Now, I understand that you've recently added urology services as well as surgical services.
We have. We've been very fortunate that they've agreed to come down here. They're here every other Tuesday. So
Both services are here every other
They
Tuesday?
are surgeries here in the morning, urology's here in the afternoon.
Great.
Which works out well for our patients that we've referred to them, as well as for patients that other providers may have referred to them, so they're not having to go all the way up to the hospital to see them. So it's a little more convenient, and just trying to, add that remarkable patient experience for people and do what we can.
Yeah, that's great for patients who live down this way because then they don't have to travel. And you're right, it's easier for you to make that consult here in the office. So that's wonderful. Yeah. Good for
Worked out
Southport.
well so far.
So I noticed you have your own nursing station here on this side also. And we
Yep.
have Melody there.
Melody's hanging out over there today for me, helping me out.
Yeah, so there's one on either end. Actually, there's a nurse's station on either end that
Yes.
makes it very convenient for the doctor.
Absolutely.
Yeah, great. Well, it's been wonderful having this tour today to see your offices. They're lovely.
Oh, thanks
And
for
I'm
showing it to everybody else.
And I'm really excited with the new services being provided here. I think that's a great thing for Southport and for the patients who live in this end of the county. So thanks again for joining us
Thank
today.
you.
You're welcome.
All right.
Well, welcome back to the show today, Dr. Robbins.
Thank you for having me.
It's a pleasure. It's a pleasure. Now, I know some of our viewers got to meet you a while back on the show, but for those of viewers out there who did not get to see that show, remind us a little bit about your background and what have you.
I am born and raised in New York. I did my medical school training at New York University in Manhattan, and followed that with urologic training at Mount Sinai Medical Center, also in Manhattan. After training, I spent 17 years in private practice on Long Island, specifically in the town of Glen Cove, with 2 other doctors.
So you moved south for the weather,
I moved
right?
south for the weather, and I've been with Novant Health Urology Partners, started in July of 2014, so we're coming on 1 year.
Great, great. Well, you mentioned your practice, Novant Health Urology Partners. Tell me, you have a physician partner, is that correct?
That is correct. Dr. Lydia Labachetta. She's born and raised in coastal North Carolina. She did her training in South Carolina at the Medical University, and she's been with Novant Health almost now 2 years.
Yeah, she's been on our show too, but it's been a little bit, I think a couple months now. So I understand that you've recently added this space here in Southport, and you're here 1 day every 2 weeks?
We're going to see patients in the Southport office every other Tuesday.
Every other
to start.
Tuesday. And will you be the urologist here in Southport?
Yes.
Okay. So Dr. Lydia will remain in the Bolivia office.
Initially, she's going to stay there, and hopefully we can drag her down to the beach with us.
Well, hopefully you'll be so busy you'll need to both be down here occasionally. So let's talk about services. What types of services will you provide here at the Southport office? I assume it's going to be similar to the Bolivia office.
Initially, we're going to hope to see patients for initial consultative services and all follow-up visits. We are limited initially on some of the procedures that we perform in the office. We don't have all the equipment available to us here at this time.
But that's something we're looking at adding.
So at least for now, for the short term, any procedures that need to be performed will be followed up in the Bolivia office.
I see. I know that you offer a large range of urological services, including surgeries. Tell me more about the types of conditions, though, that you treat.
So urologists in general treat both men and women.
Okay.
Probably we spend maybe 60% of the time treating men and 40% of the time treating women.
Really?
A lot of people think that urologists just treat men, but we treat both. We deal specifically with medical conditions associated with the kidney and the bladder in both men and women. And for men, we treat issues related to the prostate and the genital system.
I would have thought it would have been more even. I'm surprised that it's 40-60. And
we tend to see a lot of women are treated by their obstetrician gynecologist for some of the conditions, so some of them overlap. And urologists sometimes look at themselves as the primary care doctors for men. Since a lot of men don't like to see their primary care doctors, they end up seeing us instead.
We talked to Dr. Scallion about minimally invasive surgeries. Is this something that you also offer for urologic conditions?
Yes. So urologists treat patients both surgically and medically. We offer surgical procedures for the kidney, for the prostate, also minimally invasive surgery for kidney stones. So in a little bit more detail, for kidney cancer, we offer laparoscopic procedures, both laparoscopic and using the Da Vinci robot. For kidney stones, minimally invasive procedures include lithotripsy, which is a shock wave or sound wave therapy without doing any surgical intervention. We also offer laser-based ureteroscopy. For the prostate, we offer Da Vinci robotic prostatectomy, mostly done by Dr. Labachetta, and also surgical procedures for benign prostate diseases, including the green light and photovaporization of the prostate.
Wow, that's a lot of stuff that I don't quite understand. I do understand the robotic piece. I know that we had Dr. Lydia Labachetta on a few months ago, and it was concerning the Da Vinci robot. So I know that that's not available in Southport, so those patients would be done at Brunswick Medical Center, correct?
Correct. At this time, all of the surgical procedures will be done at Brunswick Medical Center. If it requires, if the patient requires a robotic surgery, Dr. Labachetta will be the primary surgeon, and I'll be her assistant.
Great. So it's a team effort there.
It's a team effort. Unfortunately, I was trained too long ago to have enough experience to do this, and at this point we work as a team together, and I will refer all those patients to her, and we'll do it as a team.
Well, that's great information about the Da Vinci robot. And at this time, let's show some videos that we have regarding some of those surgical procedures that you mentioned.
Great.
how about patients who need to see you? Do they, or want to see you, do they need a referral from their primary care, or can they self-refer? How does that work with your practice?
Most of the patients are being referred from their primary care doctors, but patients can self-refer. It all depends on their insurance. And there is no way that I could possibly figure that out. Our office staff is well equipped to deal with it.
That's what I was going to ask.
So we have our front office is Amy and Lena. They can both take care of it. If they call and patients are unsure if they need referrals, they will answer all their questions.
So they'll determine that for them ahead of time, so there are no surprises.
Correct.
So can they also help them with their co-pays, that let them know ahead of time what it will cost when they come into the office?
Yeah, it's all known to the patients based on their insurance. And again, if the patient is unsure and they ask our front office, they will be able to tell them, they should be able to inform them of their copay before the visit.
Right. That's always helpful for a patient when they come into the office to know that ahead of time, just to be better prepared.
Definitely.
Yeah, I like that too. So if patients have a question or they'd like to schedule an appointment with your office, whether it be in Southport or in Bolivia, which number should they call? Should they call the Southport office or the Bolivia office?
At this time, we're going to make appointments centrally through the Bolivia office. And if they request to be seen in Southport, the appointments will be made through the Bolivia office for here.
Okay, so they just need to specify the office that they want to be seen in.
Correct. And the office is actually offering it based on their address.
Oh, that's great.
So when a patient calls and we see that they're from Southport or closer to here, we're offering it to them without them even asking.
Yeah. Can you provide us with that phone number?
The telephone number is 721-1450.
And
ask for Lena or Amy. They're our front staff office.
Lena or Amy. And that's a 910 area code, correct? Great. Well, thanks so much for being here today. It's been a pleasure. I'm so happy to see that you're in Southport.
Thank you so much.
I think that's going to be a great thing for the folks in Southport, not to have to drive to Bolivia.
It is.
All right. Thanks again for being here.
Thank you.
Thank you for joining us on ATMC TV's Health Watch. I hope this information was beneficial to you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, local physicians, or general health information, please visit our website at novanthealth.org. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.
ATMC TV works hard to bring you the best in local programming for Brunswick and Columbus counties. Our goal is to provide local programming that is interesting, informative, and entertaining to the residents of our area. ATMC TV also offers all their information at atmctv.com. Find out when your favorite shows are airing, watch current ATMC TV episodes, check the local bulletins, or even submit a public service announcement about your organization. Be sure to check us out on the web at atmctv.com.
What is your emergency?
I think I'm being robbed.
Sir?
These big home security guys want $40 a month from me.
Let's connect you to a local company right away.
It's a crime what big national companies charge for home security monitoring. Good thing there's an affordable local option with ATMC Security. Reliable 24-hour-per-day monitoring starting as low as $17.95 per month.
Help is on the way, sir.
Oh, thank you.
ATMC Security is peace of mind you can afford. Call today for a free on-site consultation.